Welcome to the Stress Free Dentist Podcast. I'm your host, Dr. Eric Block. As always, I want to inspire, entertain, and educate you on the best tools and technologies out there. My goal is to help make your practice and career more profitable, efficient, and most importantly, more enjoyable. And check out all of my nonfiction and children's books on Amazon, and check out the stressfreedentist.com for any upcoming events. And if you're feeling you're a dental professional that's burnt out, or you just feel stuck or want to get to that next level, visit the International Academy of Dental Life Coaches, or www.iadlc.com, and we'll get you matched up with a life coach that understands dentistry. I also wanted to thank our amazing sponsor, Equa Marketing. They have helped me and my practice over the years to improve with SEO and website performance. And to find out how you can make your practice dominate in your area, go to www.equa.com/MSMSFD to book your complimentary meeting. Again, that's www.ekwa.com/MSMSFD. All right, everyone, welcome back to another episode, and I am joined by Dr. Michael Sonick. How you doing today?
Good, Eric. Nice to see you.
Thank you for sending your book here, Treating People, Not Patients. I wanted to get into all about the book and all about your kind of your career as a teacher and a dentist. It said here in the introduction, lifeguard, cocktail pianist, furniture delivery man, bartender, and periodontist. Did you do all of those things before you went to dental school?
No, I was unsuccessful as a dentist, so I had to go back and start delivering furniture. I know I can always do that. Yeah. Yeah, I grew up having to do work. My dad was a very hard worker. He grew up as an orphan in Bridgeport, Connecticut, and he worked really hard. And his mantra was hard work never killed anyone. And so he put me to work at an early age. He was an engineer, but he also had a furniture store. He was a cabinet maker. He was a craftsman, and he wanted to become a dentist. But after World War II, when he got back home, he was older, and he thought, well, I wouldn't start dentistry till I was 30. And so he didn't. He became an engineer. But he should have become a dentist because he was really good with his hands, and he would have really had a much easier time making a living than working two different jobs. So I did. So he put me to work, and I learned work from him at an early age. I worked in his furniture store. I refinished furniture. I know how to do all that kind of stuff. It's not my passion, but I had to do a lot of it as a kid, and I did move furniture. I played piano, and I spent a lot of time in the restaurant business. I spent summers waiting on tables. The piano player was sick one night, so they asked me to play. I did cocktail piano in bars up in Kennebunkport, Maine, Saratoga Springs, upstate New York, and I've done almost every job possible in a restaurant, including being a short order cook. Making salads, cooking hamburgers, and delivering food and banquet halls and all that. That's sort of where I got my hospitality training, which is what the book's about.
Yeah, I was going to say, I noticed a lot of the book is about hospitality. Of course, the title is Treating People, Not Patients.
Yep.
Did a lot of that come from your experience in the restaurant industry?
Yeah. I always I always took care of people. It's just sort of like the way I'm wired. And I want to give people good experiences. I was a leader in high school. I ran for office, and, I was involved in running clubs and, being president of the student congress. I was an actor. I did a lot of acting and, performing. That's sort of what drew me to teaching, because I really wanted to be an actor and a piano player. And my mom said that it was pretty funny. She says, where you're going to be playing piano? The corner of 3rd Avenue and 86th Street in Manhattan Savings Bank, from 12 o'clock until 1 o'clock, playing for the ladies that had the blue hair. That's where you would be playing. So to this day, whenever I walk into a lobby of a hotel, let's say a really nice hotel, there's always great music playing, and there's a piano player there. He's really good, or she's really good, but that's their gig. Is they're sitting in a hotel lobby, nobody's listening to them. I was just out at the Bellagio a few weeks ago giving a course, and there's a place called it's the Caviar Bar there, a Petrosian, and I always look at the piano player, and he's great, but he's just sitting in a Petrosian, nobody's listening to him, and I'm thinking like, well, if I was lucky, I could have gotten that job. So, but I'm very hospitality oriented. I review everything that I do in terms of hospitality. Whether I walk into a shoe store or a restaurant or a hotel, it's like, how am I being treated? Are people connecting with me? It's not like am I getting good service, but are they connecting with me as another human being? And I didn't always know about that as a dentist. The most important skill I think that I have as a dentist is being able to connect with the people that I serve and making them feel comfortable in our chair. Because when patients come in to see you, they're scared. They're scared
Mhm.
of the unknown. They're scared of pain. They're scared of like, do you know what you're doing? Are you in a good mood today? Are you going to treat me kindly? How much does it cost? I mean, is he going to lie to me? I mean, there's so much fear that's there. And my true joy is when I'm able to allay someone's fear and within 90 seconds of meeting them, because that's sort of a big deal. And if I can do that, then I have their trust. And if I have their trust, then we can have a relationship where we can actually do something, in their benefit. So the hospitality is very important. And I mean, in dental school, we're not taught hospitality. You're not taught in medical school. You're not taught about actually, there's a lot of science behind the hospitality too. If you make people feel calm and comfortable, they heal better. There's less stress, there's less cortisol shooting up. And as well as I know that there is a psychosomatic component to almost all diseases. I had it. Remember once I was in a situation where there was this person that was doing a lot of bad things to me. And this was about 30 years ago. And I was invited to this bar and this cocktail party. And I was put in a corner with this person. And I just wanted to get away, but I didn't leave. I should have. But I ended up talking to him and feeling very uncomfortable. And then the next morning when I got up, I had vertigo. And I went to the gym and I couldn't lift weights. And I talked to my trainer. He goes, "What's wrong?" I said, "Everything's spinning." And I knew it was exactly because it was that one person. I'm thinking like, okay, I got a psychosomatic illness right now. So I took some medications and I was fine, a few hours later. But I have seen many instances of patients, and even in my own life, where the stress can really cause the disease. I don't know if you know this, but I'm a periodontist, and in periodontics we have, something called acute necrotizing ulcerative gingivitis or trench mouth, and that's where you have a reversal of the T cells and the helper cells. There's a reversal in the cells, and that's brought on by stress. And so you're early on, your mouth sort of looks like you have, acquired immune deficiency, HIV, because you get the punched out lesions, you get all the, you get all the symptoms of someone that has an autoimmune disease or an immunological disease, which is what AIDS is. And when the stress is taken away, let's say someone who's going through, like, say, their final examination, ANUG goes away with some brushing of flossing. It's what's amazing is that there's a reversal of the helper repressor cells with ANUG that most people don't talk about or even know about, but it's over once the stress is taken away. So that's where does that bring us back to our patients? If I can make my patients feel comfortable, they have a lot less pain. My patients have almost no pain post-operatively, because of a number of other things we do, but a big part of it is allaying their fears and their stress. And I do a lot of things to do that. Um, I slow down. I look them in the eye. I shake their hand. I give them my business card that has my cell number on it. So every patient in my practice has my cell number. I go, call me anytime. In the weekends, I don't care. Not just during the office, anytime. And I've had experiences myself where if I could call the doctor, I would have felt a lot better earlier on. So hospitality is a very big part of our practice. I look at my practice as being a really fine restaurant. And there are three parts to reviewing a restaurant. There's the food, the service, and the decor. So we don't serve food, but we serve dentistry.
Mhm.
But we all give service, just like a restaurant. And we have to have decor. How does the office look? Is it clean? Is it neat? Do you have aromatherapy? Do you have nice plantings? Are you in a nice neighborhood? Are you neat and clean yourself? I mean, do you have nice clothes on? I mean, do you have dirty fingernails? Do you have dandruff? You go into a lot of offices. I mean, professional offices. It's like, whoa, what's going on in here? And we make a very, very big deal about having a protocol for everything we do. And of course, the most important in making people feel comfortable is providing phenomenal service. So, and that's what we try to do.
Yeah, and we in dental school we do not learn any of that. In fact, we didn't even really treat the patient like they were a person. I would talk over them. We'd have a conversation about them
Right.
as if they weren't even there. It's not the real world, and it's not how you be successful. Uh, how do you treat? Or what would you say is the difference between treating someone as a patient versus a person?
Yeah, it's everything. Where'd you go to dental school, if you don't mind me asking?
Nova Southeastern in Fort Lauderdale.
So I went to University of Connecticut. And my dean was a guy named Harold Lowe, who most people don't know, but he actually is the father of modern periodontology. He did the seminal study where he took 21 dental students, had them stop brushing for 21 days. Within 10 days, 21 out of 21 had bleeding gums. He gave them the toothbrush back and the bleeding went away within 10 days. So that was his study and it was published in 1965. And I met him in 1975 when he was the dean of my school. In the first day of school, he said to us, and was very unusual for dentists. He says, "You are now doctors. I'm going to call you doctor, even though we were freshmen." He says, "And you are physicians of the oral cavity." He says, "You are to treat the whole patient." So we did not have many requirements. We were pass fail, and we had to do, I don't know how many fillings we had to do, but it wasn't a lot. Maybe 2 dentures, maybe 3 or 4 surgeries, 30 fillings. Whereas my daughter went to the University of Texas, San Antonio. She's a dentist. She had to do hundreds of procedures. So she got out of dental school being much better with her hands than we did at a University of Connecticut. However, the difference was this. Harold Lowe was probably one of the most profound influences in my life because he said to us, he says, "You are to treat the patient and do everything that that patient needs." He goes, "Forget about the requirements." So Eric, if you were my patient and you needed periodontal therapy and you needed 4 extractions and a couple bridges, and I had to do all of that independent of my requirements. Let's say I was already done with my bridge requirement. I couldn't trade you for like a couple of endos. Okay. And that's what patients are treated like in dental school. They're treated like baseball cards. Oh, you have a Yogi Berra? Okay, yeah, I have a Willie Mays. I'll trade cards with you. I already have 2 Willie Mazes, but we couldn't trade patients. We had to do everything they needed. We still graduated, but our approach was the patient is the most important person and you have to do everything that that patient requires. We also had to treat the whole body. We had to refer them to physicians if they needed, if they had a cardiac problem, et cetera. So what's the model today for dentistry? Well, the model today is based upon the insurance industry, which started in dentistry back in the early 70s at the I believe, United Auto Workers. It was one of the benefits that they gave their union. You have dental care. So once that happened, dentists goes, okay, now we can get to build an insurance company like the physicians, because the physicians were on gravy street train right then. They had insurance and they had Medicare, and they could make a lot of money without having to bill the patient. So there's no stress. Okay, it was a stress-free position back in the early 70s because they were making a lot of money. It didn't matter. The patient didn't have to pay anything because the insurance would pay. Well, you know what's happened recently. The physicians have no more autonomy unless they're in private practice, fee for service. And that's just maybe 5 or 10%. So the insurance companies sort of ruling them, and they do in dentistry today. So what's going on today is like that early gravy train where we can sort of thought insurance was good is no longer any good because now we have to say, well, what the insurance cover? What was insurance pay, et cetera. So we're basically treating patients as procedures. What procedures can I get? What can I bill you for so that I can make a living? And that's the way people are treated today. So if you talk to most patients, do they like their dentists? Most don't. Most don't love their dentist. Maybe in your case they do, but most patients aren't referring you to their dentist. There are very few dentists that they get raving reviews because the patients really love who they are because they're not being treated that well. Now, what's happened is that we used to have about 4 or 5% of the dentists being fee for service only. When COVID came around, it changed. We were up to about 10% today. So we have about 10% of the dentists. And why did that happen? Because during COVID, people started to rewrite the story. They started to clean up their office and think about what they're doing and change their business model. I personally never took insurance, even back when I opened my practice from scratch in 1985 at a white box. Okay, it was 1,000 square feet, and I plumbed it. Actually, it was 650 square feet. I plumbed it. I put in 2 operatories. I went to the bank, and I opened up this beautiful office, and I was in a lot of debt. And I just waited for patients to come. And it took me about 8 years to become successful. It was very slow growth, but I wouldn't take insurance because I said, I'm going to build this without insurance. And then when I took in a partner about 15 years ago, Ray Ma, he says, I want to take insurance so I can get busy quicker. I go, nope, you got to wait. And then I took in my third partner and she's waiting and she's now busy. Now I'm booked 4 months in advance. My partner Ray is booked 2 months in advance. And my young associate, Stephanie, she's pretty much booked right now. So you can do it without insurance model, but it does take a little bit of a commitment to doing everything that you need to do to get your office running really smoothly. I mean, when's the last time you handed a waiter in a fine restaurant your insurance card? You don't. You pay for it. I mean, who paid for your shoes? An insurance company? No, you bought those shoes. You want two pairs of sneakers, you go out and buy them. And you go on vacation, you buy it. But medicine, it was destroyed. And the whole relationship was destroyed. It's not a capitalistic situation. It's a socialistic situation or a communist situation because somebody else is the payer, not the person that's in your chair. And that means that they don't have the control. No, you no longer have control. So you can't have that relationship anymore. So if you're going to build a fee for service practice, or even if you're not, I think it's very important to have that great relationship. But I feel that way independently. I feel that way just because of who I am as a human being. I want to have a great relationship with my patients. Now, I'll tell you, when I started practicing back in my early 30s, I didn't have this philosophy. I really wasn't sure what I was doing. But I had an idea that I wanted to give them a good experience. So when I started practice, I didn't start my practice. I started in a mall. I worked in two malls. I worked at a mall in Galleria, White Plains, the Galleria Mall, White Plains, New York. And I worked at the Holyoke Mall at Ingleside, Holyoke, Massachusetts. And I lived in Connecticut, and I drove 700 miles a week. I worked 6 days a week. I drove the stick shift Volvo with 120,000 miles on it, and I just worked. But I wanted to give the patients a good experience, even though I was in the mall working for somebody else. So on the weekend, I came in and I painted the operatory that I worked in. I hung my own artwork, and I brought in cassettes. I don't know if you remember cassettes, but those are the music cassettes. And I had like 20 cassettes. I had Willie Nelson, I had Handel, I had some rock and roll, I had Beatles, I had different things, Paul Simon. It's different music that patients would want, some jazz. And I'd give them music. I'd put dark glasses on them, and I hung up my own artwork. So I created this own little environment that was sort of nice. It was nice for me too. So that hospitable environment that I created for the patient made patient stress level drop. They felt more comfortable, and then my relationships with them were usually better. But it took a long time to get to where I am today, because just 10, 15 years ago, I'm a pretty wired guy. So I was going, 100 miles an hour in and out of patients. How you doing? And then I had a consultant come in and says, Mike, you're really good at what you do, but you got to slow down.
Mhm.
So I started to slow down. And your podcast is called Stress Free Dentist. I love that, because there's two criteria that I always look at when I'm evaluating anything I do in my life, whether it's dentistry or whether it's how am I going to get to the store? It's like, what's my stress level? Okay. And how predictable and how comfortable and how effective am I going to be? So it's like, is this going to make me more effective or less effective? More stress or less stress? I even did one of these little Punnett squares when I teach. I look at everything. So my goal is low stress, increased effectiveness. So how do I do that? I spend more time with my patients, talking very slowly, looking them in the eye, knee to knee, same level. And I always say, what can I do for you? You're here with me now. Is there any question you want to ask me before I leave? Because now's the best time to do it. And I pause. And in that pause, the patient has an opportunity to ask me a question or not. And then I stop again. I go, are you sure you don't have anything to ask me? They go, no, I'm good. And how often does a doctor slow down and say, hey, look, before I leave, please ask me any questions and look at you? Oftentimes the doctors never make eye contact because their back is to you and they're typing into a computer. And then I reach into my pocket, or my assistant usually hands me a card. And on my business card, as I mentioned to you when we were talking earlier, is my cell phone and my personal email. I go, here's my card. If you have a question that you forgot that you wanted to ask me, call me on my cell anytime. And how often does it happen? Every week I get 2 or 3 phone calls from somebody, usually a 90-year-old person, maybe at home, and they're a little nervous. I had a multimillionaire call me this week. It was very funny. She's now in a retirement home. I've been treating her for 20 years. I know how much she's worth because her husband sold the company for $200 million. She says, I no longer have insurance. She's 90. Okay. She's a multimillionaire. Her son actually bought, I can't mention the name of the company, but a company you would know, for $350 million. And she says, do you take Medicare? And I started laughing. I said, you're having financial problems now? That's because she's 90 years old. But we had a nice little talk. And at the end of the conversation, I told her I'd be calling her to take her out to dinner this summer because, she's a lot of fun. But it gave her a sense of comfort that she can call me. And I can't tell you how often patients will say to me or to another one of my patients, I called him on a weekend. He was in Vienna and he called me back. It takes me a second. You know what I love, Eric? I love getting called on Sunday morning when someone breaks a tooth, because I know they are going to be so happy I picked up the phone and then I could take care of them. If I couldn't take care of myself, one of my partners would come in, but they're usually getting taken care of within an hour on a Sunday morning. And I've had that problem myself. I knocked out my own teeth on Thanksgiving, and I had to call my dentist on a Saturday morning after Thanksgiving, after I had a bad bike accident, and he was able to come in with his wife and take care of me. And that dentist he just is just a great guy, Dr. Min Yoon, his wife. I know I'm going on and on and on about hospitality and things like that, but I'm just so passionate about it. And I'm passionate about giving people a great experience because there's nothing better than that. It's more of a gift to me than it is of the people that I give the gifts to.
Do you think that's a major barrier for dentists these days? Is the insurance situation, and just dentists trying to go, be too fast and try to be
Yeah.
overly productive and not slow down?
Yeah, I definitely, I mean, I see that all the time. Um, I was on a podcast with somebody, a good friend of mine. They happen to also be she's not a dentist, but she's a psychologist. And we started getting into the conversation of by being more effective by slowing down. How can you be so effective? How can you make money if you're slow? And I make a very good living. Could I make more money by going faster? No, I'd probably make less if I could think I went faster. And there's a movement. I don't know if you've heard of it, the slow dentistry movement coming out of Europe. It's like, it's taking your time, doing everything that's needed. Half my day I talk, and the other half I work. And if I wasn't talking, the effectiveness of my work would not really be there. And I don't do one tooth dentistry. In my office, again from Harold Lowe, we had to treat everybody comprehensively, and so everybody gets a comprehensive exam. They spend an hour with me at the initial visit. 95% of the patients in the United States enter the dental office through the hygienist, and so the dentist pops in, and they get 3 minutes to do an exam. And what do they look for? They look for low hanging fruit. Oh, you got to come in for that crown or for restoration, or you need endo. And there's no relation. They don't know what they're coming in for. They're confused. So there's a couple pointers for your listeners, whether you're practicing a week or if you're practicing 25, 30 years. I would say that most dentists never write a letter to their patients. So every one of my patients gets a 2 or 3 page letter the day of their first visit. Now, like Eric, if you refer to be a patient for care, you get a letter from me as a dentist, but I'd also copy that patient. And on my website, michaelsonick.com, I have a template of what that letter looks like, including a video of the patient that received that initial letter, her talking about the experience of getting that letter. It opens up those doors of communication, and it makes everything transparent. What I say to patients, because patients don't know what we're doing, we talk a completely different language, and they have no idea what's going on in their mouth. I say to them, I said, you know who I am? I'm the Wizard of Oz, okay? And you're Dorothy, or you're the Cowardly Lion or Tin Man Scarecrow. I said, I'm just a man. I said, but you think I have all this power? I said, here I go. And I pull back the drapes. I go, this is what we're doing. And I make everything very transparent. So if someone's coming in and let's say they need a surgical procedure, connective tissue graft, or a bone graft, or corticotomy or something. I said, let me show you what it's like. And boom, pop up with a PowerPoint, and on a big projector, I show them procedure. Like a lot of dentists go, I can't show it to a patient. They're going to get scared. Well, I'd rather see them see my work than see somebody's work from another country, that's poorly done, or this country that's poorly done. But I'd rather me explain everything to them. And then once I show that to them, they usually don't get grossed out. They go, oh, that's it? Their whole mandible could be degloved. They go, oh, that's all you're doing? I go, yeah, that's all we're going to do. And then I show them a 1 week follow-up, and they think it's going to be gross. They go, oh, that doesn't look too bad, and then I show them the final. So when I take people through that process, it takes away a lot of the fear. And so that letter to a patient is important. Matter of fact, I send a letter to a patient almost anytime I do a procedure. I just do a follow-up. Because like if you're coming in for an implant, for example, it's a long process. You take out the tooth, you do the bone graft, you have a provisional, you take a cone beam, you take a digital scan, you make a stent, you place the implant, you let it heal for 3 months, you uncover it, maybe with a soft tissue graft, and then a provisional, and then 3 months. It can go on for a year, and some of the bigger cases longer. So every step is given to the patient. Now, what do most doctors do? They do a computer printout, and they send a computer printout. And when the patients will come into my office for a second opinion, they'll show me the computer printout. Now, I'm a pretty seasoned dentist. I've been doing this for 40 years. I look at these computer printouts. I look at them. I go, I don't even know what this dentist is talking about. I can't read all this thing. It's confusing to me. So what
Mhm.
I do is I bullet it. I give them 10 steps, but every step is not a procedure. Sometimes the steps are heal for 3 months because sometimes patients will say, I thought this was going to be done already. I go, well, this is a year process or it's a 6 month process. Because like I can't speed up bone healing. I can't speed up soft tissue healing. It's not really up to me. And so sometimes patients get impatient. And so, like, if you came in as a new patient today, Eric, and your procedure is going to take a year, I would say, okay, it's January, whatever, isn't it? What date is? Oh, my wife, it says January 1st. Okay, I got to fix my watch. It's April 1st. So I says, April 1st, you'll have your final crown in on April 1st of next year. So April Fool's Day of next year, you'll have your crown. And so I'll tell them that, and they'll have the whole thing. And then what happens? About 3 months before, they go, this is taking a long time. I go, it takes a year. They go, I thought it was going to, I said, did you see the letter? Yeah, I saw the letter. So it helps for me to have very clear communication with the patients. So any advice that I'd give anybody who's in practice, slow down, take your time to do a comprehensive examination, diagnose everything that that patient needs, and then have a really good conversation about the pros and cons of treating versus not treating. They don't have to do everything, but they do have to, in my opinion, know everything. It's not our responsibility to do everything that a patient needs. It's our responsibility to give patients all the information about what can be done so that they can make the right decision for themselves. And most doctors don't do that. Why? So they don't do it because they're afraid. They're afraid a patient's going to say no. And they will sell dentistry to what level they think the patient will accept. And then that's a disservice to the patients. I don't care if all my patients say no. I mean, I don't mean that, but they have to be informed. If they don't want to do the treatment, that's totally up to them. But I've done my job and I can go to sleep at night with a clear conscience because the patient knows everything that they need to know about their treatment, or I try to. That's a whole other conversation about co-diagnosis, co-treatment planning. It's the work of Bob Barkley. I don't know if you know him. He passed away in 1974, but it's that whole philosophy of getting the patient and the doctor on the same page so that you can make the decision together. Tal Gawande out of Boston talks about that all the time, the very famous physician out of Harvard. He wrote the Checklist Manifesto, another great book that I recommend that all your listeners read. Checklist Manifesto is a phenomenal book. Should be on a reading list of every dental school, but it's not. So
It sounds like, you're making this great relationship with the patient. You're giving them your email, your cell phone, you're sending letters, um, you're laying out all the information. Does that really help you kind of not beat yourself up when there is a difficult conversation or if a patient does say no?
yeah, it helps a lot because I've done my job. I've done the best I can and I've told them everything. I'm not hiding anything. I think, I'm a little older, so, I've been doing this for a long time. So as you get older, I mean, here's a little joke for you. At 20, everyone's talking about you. At 40, everyone's talking about you, but you don't care. When you're 60, you realize nobody's talking about you. So when you get older, it's like I saw Seinfeld in concert a couple of years ago, 3 years ago, because he's 70 now. So he was 60, I don't know, he was 66 at the time he was in concert. He goes, I love being 66. He says, someone wants me to do something? Nah, I just tell them no. I don't have to say yes anymore because I can't wait till I'm 70. Because at 70, if somebody asks me something, I'm not even going to answer them. I'm just going to keep walking. And, if you're older, you can sort of relate to that because when you're younger, you want to be a people pleaser, you want people to like you, etc. Um, I'm not that concerned about people liking me as much as them respecting me and knowing that I'm being honest with them. I'm not there to make friends. Why do people come to see me? Come see me to fix their teeth. Pretty much it. And whatever else is wrong with them physically, because I have a whole network. I have over probably 1,000 doctors on what I call top doctors. They're throughout the country. They could be like if you move to Tampa and you need a neurologist, I may have somebody for you down there, a dermatologist. I definitely have a periodontist there for you and a general dentist. I have them all over the world actually. And I've been keeping this list for about 30 years. So I keep on adding to it and taking away and putting people on. So if I meet a great orthopedic surgeon that's at HSS in New York, did a great knee replacement surgery, he goes on my list. So if someone needs somebody. So what was the point I was making here? I got off topic for a second. Having good doctors, referring deals. Oh, respect. So it's important that they respect me and that they know they're getting the right advice. Because it's not a popularity contest. And I read an interview with Harrison Ford, the actor, a few years ago, and he says, "What's the most overrated trait in a human being?" He says, "Charm." He says, "I'm not there to be charming." And I'll tell you something. Don't you know it, Eric? When someone's being charming with you, it's like, will you just have an honest conversation with you and stop this? Can we get right to it? So I just had a contractor at my house, and he started doing building, and he screwed up with the permit, so I got to move something over there. And he was just matter of fact, yeah, they did it here, we're doing it here. There was no charm. He just, and like I trusted him completely. He wasn't even really talking to me. He was talking to the electrician. The two were talking, and I thought about being a dentist. Like there's a couple of dentists talking. I mean, they could have been a little bit more inclusive and loop me into the conversation, but they were charming me, and I could see they really cared. They spent 45 minutes laying out what they had to lay out. It's a small job, but I just liked the way they were. And my wife goes, "How'd it go?" I go, "Good. I trust them." Because most times you don't trust your contractor. By the way, it took me 2.5 years to find these two contractors because it's very hard. Like, you got a good plumber? If you do, save them, because nobody else has a good plumber. It's really hard to find, good people. Got a good dentist, got a good endodontist, it's hard to find really good people. I call it the 2% rule. 2% in any field, doesn't matter. Could be a book publisher, it could be a copy repair person. 2% are really good. And out of that 2%, 0.2% are excellent. Okay. So there's no competition in a niche. Now, what I'm telling your listeners and you, then things that I do, it's hard work. It takes a lot of effort. But as you and I were talking, when you're in your unique ability, when you're doing what you love, it's not hard work. I have no choice. I have to do this. Now, one of my mentors, and he gave me the blurb on my book, Danny Meyer. So he wrote, "Mike's deeper calling is to use hospitality gifts to make people feel better. His lessons applied to any customer-facing business." Now, most people don't know who Danny Meyer is. He's the most famous restaurateur in the world. Okay, so having that quote on my book means a lot to me, but not to many other people. So Danny Meyer, he started Shake Shack. Everyone knows Shake Shack, but he's got 30 of the top restaurants in New York City, 3 of them in the top 30. Gramercy Tavern, Union Square Cafe, and 11 Madison Park. Those were his restaurants. And what Danny Meyer learned early on, because we were about the same age, and he opened his restaurant the same year I opened my practice, 1985, is the customer service is really important. He has good food, but great customer service. Now, Danny Meyer's a billionaire. Now, I don't know him. Well, I know him now, but I didn't know him personally, and I wanted to meet him. So every year we take my whole team to a Danny Meyer restaurant in New York City. And this a few years ago, we went to a place called The Modern, which is in the Museum of Modern Art. It's the only Michelin star restaurant in a museum in the world. And we got a special room overlooking the sculpture garden. I take my team every August. We go to New York City, usually to a Danny Meyer restaurant. And I said, "Is Danny Meyer going to come in?" I didn't think he'd come in. And they go, "No, he's out of town. He's busy, whatever." So Danny Meyer has, I don't know, between Shake Shack and this, thousands of restaurants. He's got all these businesses. I go into the restaurant, and the maitre d' says, "I'm sorry, Danny Meyer couldn't make it today." And he hands me a book. He says, "But he wanted you to have this book." He gave me a copy of his book, setting the table, and wrote, "To Mike, here's the hospitality in the dental chair, Danny." Now, I didn't even know him at that time. Okay, I'm just one person out of the thousands that he deals with. Now, why did he give me that book? Did he need my business? He didn't. But that's just the way he's wired. And when I got that, it almost brought tears to my eyes, not because he remembered me, but because he actually walked the walk. He walked his talk. And what he wrote in his book, and his book's called Setting the Table, another great book that I recommend your listeners read, because it talks all about hospitality. My book is patterned after that, his book, because it talks about hospitality through dentistry. His talks about it through food. But it's the same algorithm that we use. It's like, be there for people, work really hard. Okay, it's really simple, but it's not so easy. Okay, it's not so easy to do. It's not that hard. It's not that complicated, but most people can't do it. Like, you want to lose weight? I'll tell you how to do it. Eat less food. That's how you lose weight. It works for everybody. You don't need a special diet. You don't have to go keto. You don't have to go Mediterranean. You don't have to go vegan. You don't have to eat just pineapple. Don't have to monitor yourself this way. Take the supplements. Just don't eat. You will lose weight. I guarantee it will work for everybody. I've never seen anybody not eat and then put on weight. This doesn't work that way. You want to get in better shape? Exercise every day. It works for everybody every day. So you're too tired? Go to sleep. Okay. Most people don't sleep enough. They don't eat properly. They don't exercise. It's, want to lower your stress? spend some time in nature by yourself, do some prayer, meditation, go to yoga class, simple stuff. It's really, all this stuff is really simple, but nobody does it. Now, here's the good news. If you do it, you'll be really successful because nobody's doing it. There's no competition in a niche. There's no competition in a niche. And, that's why when COVID hit, uh, people like you started a podcast. I wrote my book. There was an opportunity. And the entrepreneurs out there, which aren't many of them, said, okay, they didn't complain. I started a podcast during COVID. It was just during COVID I did it. And I did it for all the people in my community. I had 200 people on every Monday morning for 2 hours. I didn't know what the hell I was talking about, but at least I had a forum where people could get on and talk about COVID. Matter of fact, you'll laugh at this. I was running Zoom meetings on COVID with 200 people. I didn't know how to run it. So we'd have 200 people talking at the same time. Some people would come on, scantily dressed. They didn't realize everybody could see them. It was early on during Zoom. You remember those days? It was very funny. So anyway, there's a lot of
Man.
opportunity out there for people. I mean, if you just start to, work hard and do the right thing. So what's the right thing? And that's the problem. What is the right thing? It is independent. It is independent of what a lot of other people are saying, because most people don't do the right thing. You got to find mentors out there. Find somebody who's doing it. Find someone who's really that you respect that's doing it, and do everything they do, or call them and ask them. So this quarter, my goal is to call 5 of the most influential people in hospitality in the world, people that you would probably not call me back, and I'm going to connect with them all this quarter. And if I talk to you in 3 months, I'm probably going to say, 4 out of 5 call me back, and I now have a relationship with them. But I wouldn't unless I made the phone call. Most people who are busy and who are good at what they do are happy to share it with you. I found that out early in my career. I walked up to the greats, when they got off the podium, I go, "Can I talk to you?" And this was before cell phones, and they would give me their home phone number, and I'd call them at night. It was sort of cool. So,
Oh man, you've given so much great advice, so many great nuggets for anyone practicing, or especially the young dentists out there, to really create that that relationship with the patient, treat patients like people, and give them that hospitality. How do we find out more about what you're up to, your books, your speeches, your website?
well, I do a number of things. My website is my name, michaelsonick.com, Sonick. Just spell out my name. And you can get my book on the website. It's sold through Amazon. It's in audio, it's in Kindle. I do the audio. It's 6.5 hours of audio if you want to listen to me for 6.5 hours. I do speak a little slower when I'm reading the book. I also have a series of videos on how do you bring the culture to your office. So if you want to, we didn't talk about team at all. By the way, none of what I do and I talk about could I do if I didn't have a great team. I have 22 people working for me and 2 partners, and I brought the culture to them and I'm training them. And what's nice is that if I work 2 days a week, so if I'm gone for 2 weeks to come back, the office is still running. I'm not going to say as good as when I was there, but 99%, it's pretty good. There's a piece of trash in the bushes that someone didn't pick up. Light bulb may be out in a downstairs bathroom or something, but most of it's going pretty smoothly, which I'm amazed at, because we have like how many when you have 20 people and all these people coming and going, it's like 10,000 possibilities on a daily basis to screw up, right? It's amazing if things go as smooth as they do. So you can go to my website and you can get those videos, you can get the book. I do keynote speaking. I'm booked about a year in advance, speaking at large groups, small groups. I work with different companies. I'm bringing this culture now not only to dentists but to physicians. I've lectured for plastic surgeons. I've lectured to lawyers. I'm now lecturing for corporations. People like especially corporations. I'm start with are the dental corporations. People who the big companies that we all work with that you'll know. I'm lecturing at the Shine Thrive in the Bellagio, and I think May. I'm giving a keynote there on treating people, not patients. And so I'm having a lot of fun with this. I also teach clinically. I work at the Zimmer Biomet, and now ZimV Institute. I teach cadaver courses on surgery. I do soft tissue courses. I do pig jaw courses. So I give a number there and at various universities. But the easiest place to get me is at my website, and you'll see all the courses that I give. I'm lecturing at least once a week somewhere. That's my passion.
All right, my man, michaelsonick.com. Go check it out. Michael Sonick, thank you so much for joining us. Such a great episode.
Well, thank you. It's been a pleasure sharing this with you, and thanks for having me on, Eric.
Thanks again for listening to the Stress Free Dentist podcast. And don't hesitate to get in touch with me at info@thestressfreedentist.com. And if you haven't already, please subscribe on your favorite platform and leave us a review. Until the next episode, I'm Dr. Eric Block, the Stress Free Dentist.